In 1984, a Seventh-day Adventist psychiatrist, Dr. Japie Vermaak, had a patient in a general hospital, and the patient was a suicide risk. Unfortunately, over the weekend, the patient committed suicide, and Dr. Japie Vermaak was really inspired in a sense, but sadly so, because of the loss of this patient, to create a therapeutic milieu where patients at such risk can be well taken care of. And so Dr. Japie Vermaak was the originator, and he founded Vista Clinic through a lot of hardships. But soon he realized that Vista Clinic by his own and on his own will not become what he envisaged. And he approached an organization which basically is colleagues, Adventist Professional Health and Humanitarian Services, APHHS in short. And they bought into this whole dream and this whole vision. And the first hospital in the house of Dr. Vermaak, with just a few beds, 34 beds, today through that partnership with APHHS has grown a footprint that is much wider than just the local Centurion-based national recognized hospital. Currently today, Vista Clinic operates a hospital with 158 licensed beds for private psychiatry. It is considered and it is recognized as the leader in specialized psychiatric care in South Africa, and has spearheaded many a new engagement on therapy and therapeutic outcomes, not just locally, but also internationally. Today, APHHS has the majority share in the business, and as such, APHHS, the majority shareholder, is with Dr. Vermaak running the hospital in a trust. So the legal entity is a board of trustees, and so being a board of trustees in the South African environment, it means that there are beneficiaries to that trust, and the beneficiaries to the trust is specifically the same as the shareholding, so to speak, in the business, which is APHHS has the majority share. So what is the role of APHHS at Vista? It has become the guarantor of the business. But as a board of trustees and chaired by Dr. Peter Landless, the General Conference Health Ministries Director, according to the World Health Organization, the number one disability disease globally is mental illness. And so being an acute hospital that does acute immediate intervention on psychiatric illnesses, we fulfill that mission of really addressing this huge global need that exists in the mental health space. But according to the World Health Organization, the biggest barrier to treatment is stigma, apart from accessibility and political will to really address the matter of mental illness. And so APHHS has become the great sponsor to destigmatize mental illness. And the various brands that exist, and I'll tell you briefly about that, is Crazy for Walking. The word crazy is a very daring word, and we have discovered that the way to address a stigma is to actually embrace the very stigma. The word crazy is, a word used every day. I'm crazy in love with my wife. I'm really crazy when I jump out of the plane and do parachuting or bungee jumping. But when crazy is used in mental illness, it brings about a barrier and a resistance for people to seek help, to reach out and to be treated. And thus, we embraced the word crazy, and we started doing crazy things just to normalize and also to take on a very difficult subject of stigma. And Crazy for Walking started out by some crazy employees at Vista that walked from Pretoria to Cape Town 1,500 kilometers. It took them 5 weeks. It's really crazy what they did. But through that we got national exposure, we got international exposure. We have all sorts of great stuff. We've got crazy socks that we wear and all those kind of things. And every year on the 10th of October and the week before that, which is World Mental Health Day, we initiate a national-wide campaign where people walk. And in walking, they donate their steps towards destigmatizing mental illness. So from this basic brand, other brands were developed. You cannot just take on this big challenge of mental illness without educating people on mental wellness. And so the Mental Wellness Initiative is known as Happiness Helps, wherein the HELPS, H-E-L-P-S, is an acronym of 5 well-researched clinical elements that enhances and bring about mental wellness. So HELPS, Happiness Helps, the H stands for help others, E stands for exercise, L stands for learn something new every day, the P stands for play, and the S, spiritual growth as well as meaningful social networking. Recently, we have partnered with an organization and have sponsored a new initiative which is called You Matter. And You Matter is an initiative that was started by 3 ladies, all of them affected by suicide. Their spouses committed suicide, family members of them committed suicide. And we realized that literally there is nowhere a support group or there's nowhere an awareness group of those people that are affected by suicide, people that are left behind when someone has committed suicide. Suicide, by the way, is the #1 cause of death globally for 15 to 25-year-old females.
Okay, so the crazy buck is doing his thing again, the garden route nuts and bolts rally.
APHHS and Vista Clinic sponsored a crazy rally car, the Crazy Buck, that's been driving rallies. And this car has become a brand and is known throughout South Africa and has actually won numerous prizes for community influence, positive community influence. Annually and monthly, Vista Clinic is also with APHHS associated with and donating towards missionary hospitals where there is dire need for primary health care and acute care, such as Maluti Hospital. And so the contributions from APHHS towards Maluti Hospital, deriving from the business at Vista Clinic, is also an extension beyond our borders into the neighboring country of Lesotho. To create a therapeutic milieu, it means that the environment needs to add value to the therapeutic intervention. What am I saying by that? Open spaces, in contact with nature, trees and green environments is rather important for good healing of the psyche. Whole person wellness is important to us, and so people may not necessarily know this, but in the subconscious a lot of things are happening, a lot is at work. And so art is many times an expression of the subconscious being, and thus we have various art forms. We have a sculpture park by renowned Anton Smit. We also intend to have weekend concerts with a little concert hall that we have, reintegrating our patients into a uplifting and positive society. The investment in bringing visitors to patients as part of the therapeutic environment is something that APHHS has been supporting, and so we've created a visitors area or a visitors park with a lovely deli. The deli is called dopamine, I think very fittingly so, because those are the hormones that brings the feel good. Our chapel, of course, is in the heart of everything, because whole person wellness is about bio, psycho, social, and spiritual intervention. And all four of those areas are continuously developed and redesigned and redeveloped to create the ideal therapeutic milieu. Very recently, we have developed an online learning space, and it is the Vista Academy. The online learning space is now available for anyone everywhere in the world, and this is creating opportunity to learn about psychiatric illnesses, treatment modalities, as well as therapeutic interventions. In conclusion, APHHS majority shareholder at Vista Clinic is the sponsor, is the guarantor of developing further and greater footprint to really take on the stigma of mental illness, to treat psychiatric illnesses, to educate in mental wellness, and to support those that have been affected by suicide. This is the mission, this is the passion, this is the drive, and this is the contribution that APHHS through Vista Clinic has been doing over the years and are growing every year to have a greater impact, not just in the community and locally, but nationally and internationally.